Today, joining me is ED consultant Dr. Andrew Winge. He is joining me from the UAE today. He also owns his own men's health company, which is manmedicine.com. And today we are going to be talking about testosterone deficiency and causes of testosterone deficiency, but looking more at endocrine disrupting compounds. So, Andrew, over to you.
Thank you for having me. I really appreciate it. Endocrine disrupting compounds, I guess we should maybe talk about definitions first, because we throw that term around a lot, EDCs. I think of them very simply as these are chemicals in the environment, obviously man-made, that interfere with the body's natural hormones. And I try to keep it as simple as that. So it can be testosterone, obviously, it can be estradiol, it could be thyroid, it could be something that interferes with any of the bodily hormones out there. And I wondered over the years, what is driving this low testosterone phenomenon? Because I'm sure, as many of the listeners are aware, there's been a very steady decline in men's testosterone levels going back at least until the 1970s. There's been an associated drop in sperm counts, sperm quality, or formed sperm, that sort of thing, that parallels that going back at least from the 60s at least. So something is going on that is causing this, and I always assumed it was the usual culprits: poor lifestyle, obesity, lack of exercise, all of the normal stuff that we all associate with low testosterone. And obviously that stuff, I think, still does play a major role in it. But as I learn more about endocrine disrupting compounds and just how pervasive they are and how dangerous and how many of them there are, I'm starting to think that that's really the primary driver of this phenomenon. And again, I could be wrong about that, but I feel like these compounds are behind many of the health issues. We're going to talk about hormones, obviously, but I have a feeling that they are one of the primary drivers in high cancer rates that we're seeing, especially high cancer rates in younger people, which is a relatively new phenomenon. It's not uncommon now to see women in their 30s presenting with stage 4 breast cancer. I have a close colleague of mine who was diagnosed with stage 4 colon cancer in her mid-30s. So that's not something that's very common, but it's becoming increasingly common. And we don't have a good explanation for why that's happening, but I have a feeling that these environmental chemicals, which are in our food or water, air, all those sorts of things are playing a role in that. And we desperately need more research in this area to figure this out. But clearly something is going on. We're seeing men, I know you in your clinic see this as well, I know that I do, men in their early 20s who are they're not just a little bit hypogonadal, they're profoundly hypogonadal. They have testosterone levels of 90-year-old men. And this is something that I never used to see. Even 10 years ago, it was a bit uncommon, but it's extremely common now.
What's interesting as well is looking at the studies that have been done worldwide. So we're not talking like epidemiologically sort of identifiable groups of people who are having similar lifestyles and things. And you mentioned about lifestyle having an impact on, for example, testosterone deficiency. And obviously it does, body habitus and diet and sort of metabolic flexibility and obesity and things. But actually, we're talking about people who are living in remote locations, in quite rural locations.
Right.
Similarly affected. And actually, thinking about the BPAs, for example, and the plastics and even the PVCs and things as well, that are reaching our food supply, that are reaching our kids' toys, is such a massive problem, and it's so diverse because we are so far away from the source of our food, so it gets packaged, chemicals put on it, and even I was really sad to find out when you're thinking, oh, well, I'll do my bit, I'll eat organic where I can, but that's not a thing because apparently it only classes as organic if it's, well, I think it's different in different countries, but the field needs to have been free of synthetic pesticides for 3 years only, I think. So, which actually is a really different ask.
Yes, it is. Absolutely. There's all these loopholes. I think it's far worse in the United States than it is in Europe, from what I hear. Our politicians in the U.S. have been paid off by the food and drug and chemical industry. So there are all sorts of loopholes, like in terms of bisphenols, BPA has largely been banned in the United States, which is really meaningless. It's completely meaningless, but it's actually a marketing ploy, because now when you buy, buy a thermos or something like that that's made of plastic, I'll put a label on it that says BPA free. Well, that doesn't mean it's bisphenol free. It's just BPA free. Now there's BPA like AZ. So there's all sorts of other BP compounds, other bisphenols, which are equally estrogenic, equally endocrine disrupting, and then, have just not been studied. And those are all allowed. So the chemical industry didn't raise a fuss when BPA was banned, not at all, because they knew that they had all these other agents that they could use that were equally inexpensive, and they could just substitute that, over factories and continue profiting. And so it's a big problem. We're going to need, there needs to be comprehensive legislation, I think, in all countries, really worldwide, that bans entire these chemicals, like all bisphenols, all phthalates, because if you just do the whack-a-mole approach, so to speak, just ban individual ones, which seems to be what they're doing now, we're just never going to get, never going to get a handle on this. So it's, yeah, a bit troubling.
And I think as a consumer, it's really hard to know where to go as well, because they're so, cookware, that a lot of these EDCs are a lot more damaging and a lot more mobile, and they get into people's systems faster once they've been heated up. Well, that's a lot of cookware, isn't it? So towards glasses, stainless steel and things like that, which can be better, but often they'll coat those as well to try and make them a better product, etc. And then, the parabens and things that you find in cosmetics, shower gels.
That's a huge one. That's a huge one. Yeah, personal products are deadly. I mean, they're loaded, especially, anything that has a fragrance in it for the most part really should be, you should try to eliminate that as all possible.
Yeah.
Because it's in everything.
And it's knowing what where the damage is done, and that will get eliminated. And if all that damage for long periods, or if you can obviously identify it as being an issue, using those products and things will be beneficial. But I think we were talking about earlier about the fact that actually in utero exposure is already impacting that fetus's life.
Absolutely. Yeah. They're exactly. They're lipophilic. They not only impact the placenta directly, but obviously they cross the placental barrier and they affect the developing fetus, which is, again, it's so sort of terrifying for the future when you think about it. Born in 1973. So I have been exposed like everybody else to these sorts of things, but the level of exposure, let's say in the 3 or 4 years of my life, was relatively low compared to children being born today. They're being exposed in utero as a developing fetus. And we know in animals, we know in lab rats specifically, there's all sorts of congenital malformations that happen to these little mice when they're exposed to this stuff in utero, that profoundly affects them for the rest of their life, and the rest of their life is usually truncated because they do develop cancers at higher rates. They have all sorts of reproductive problems. But the kids being born today are being exposed to this stuff at high levels, again, before they're even born. And so it's sort of no wonder that we're having 22-year-old men that are, with serum testosterone levels in our US units of like 250 deciliter for total testosterone, which really, if you look at even some of the old data, is not even a healthy level for like an 8-year-old man. It's actually lower than what a healthy 85-year-old should have. So that's sort of scary when your peak testosterone is your levels of peak testosterone never get out of the hypogonadal range and only go down from there. The man is that on the other side of that at age 30, 40, 50, they're going to have all sorts of chronic metabolic issues and probably a lot of issues that we haven't seen yet or that are unpredictable. It's terrifying, and women are not exempt from this, obviously. I mean, we're men here, but this is going to be a major issue for women. We're all seeing like more ovarian syndrome and other reproductive things, early breast cancers, as I alluded to earlier. So this is something that is going to affect both men and women. There was oh, go ahead. Oh, I just was saying there was another really terrifying study that I read a while back about mice, and more about epigenetics and how environmental changes in, let's say, generation 1 are transmitted to generation 2, 3, and 4, even though they may not be exposed to the same environment that generation 1 does. So what I mean by that, there was a study where they took female who were pregnant and they exposed them to high levels of these endocrine disruptors. I think it was, I can't remember if it was bisphenols or phthalates. It doesn't matter, but so the female offspring that were born from those mice suffered from the exposure. They had a number of congenital issues and cancers and things like that. What was interesting, though, is that their offspring, so the grandchildren, so to speak, of that first generation, also suffered the same effect that the parents did. So this was, and despite not being exposed anymore. So there were epigenetic changes that were transmitted multi-generationally, even though the exposure was gone. So that would mean, it translates into humans, which there's every reason to think that it might. Even if we eliminated all of these endocrine disrupting compounds today, we might still be living with the effects of these things in the next generation, possibly the generation after that. So
And I think
this is really concerning.
Really, absolutely. And I think one of the hardest things about all of this is that when you think about the numbers, the vast numbers of people that are being impacted by this, you can't say, well, why aren't we doing more about it? And why aren't we doing more research? Well, obviously, most of our data comes from observational data, for obvious reasons, because you can't, there's going to sign up for that trial. Certainly, in human models.
Right.
And there's a lot of criticism saying that actually rodent models aren't going to be as representative because of in different elements of our things, rodent metabolism, etc. But that actually would make it seem that we would do worse out of that, surely, if we're metabolizing.
Possibly. Yeah.
But it's also, I think, the fact that there are so many different industries that are benefiting use of a lot of these products. That it's most difficult to know how to, and bearing in mind this is a global problem, and a lot of these industries are global, they're different, going to be taking legislation over those different industries as well, thinking about pesticides and actually thinking about how much our food moves or moved from country to country just to be packaged and sold. So the scale of it is massive, and
It's huge. It's huge
for it.
But that's the difficult part, because let's say in the UK or in the US, if the majority of these compounds are in fact banned, there's nothing to stop these large agro companies and chemical companies from just moving somewhere else where they don't have the same sort of legislative protections, and they can continue to do business as usual. And we've seen that with I think atrazine in particular has been like totally banned in Europe for like several decades, but is still being used in the United States, and so is still causing toxicity. But there's in the U.S. and I know in a lot of other countries, these chemical and companies have a lot of influence. They have the political decisions with financial contributions. So there's an element of sort of corruption there. And so, in many ways on our own, that's kind of how I look at it. I mean, I would see like a global on these things, but until that happens, we have to do what we can to protect ourselves. Maybe we'll get into that a little bit. It's not really to think that you'll have zero exposure.
Yeah, absolutely. So. And I think, thinking as a parent is one of those things that you want to think about your most preconception for exposures are going to be like, and sort of try and both parents add to that. And that's stuff like, obviously, we use cookware, look about plastics and things. I think for me, one of the things you kind of think about getting as close to your food source as possible.
Yes, absolutely.
The
Yeah.
less
And do your best to eat organic. There's a pretty good resource I'll share with the listeners. If they go to it's the Environmental Working Group website. I have it up here to give you the exact website, but it's the Environmental Working Group. They have some really good informational pamphlets and some things that people can read about. And, they talk about certain fruits and vegetables that are known to have higher levels of pesticides than others. So they have a group of vegetables they call the dirty dozen, which is like you want to kind of avoid. And because there just tends to be higher pesticide use in the cultivation of those particular items. And then there's other ones like I think the avocados they use as an example require very little to no pesticides. So avocados, you tend to be a little more safe eating those. But they have a whole list of foods that are considered to be safer. Nothing is completely safe.
Yeah.
And then they have a list of like consumer products as well, things that have been known to be particularly high phthalates, like product shampoos, some that are actually a little bit lower. So, when you go to the store, you order online, you can maybe start making some better choices using that information. It's a pretty good resource that's out there. And then there's also there's two books I want to plug as well. One has been around for a while by Dr. Anthony J, he's a PhD. I don't know what his PhD is in, but he's a pretty brilliant guy. He's done a number of YouTube channels, but his book, Estrogeneration, has been around on Amazon. It's an excellent book on endocrine disrupting compounds, all of these estrogen mimicking chemicals that are out there. I thought it was really, really informative and useful. And then the other one, there's a researcher called Shanna Swan. She's also a PhD. SWAN is her last name, and it's a book called Countdown. And the title book is I have it up here. It's Countdown: How Our Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Health. And it's also really, really good. And she's been around a long time. She's like, I think in her mid-70s at this point, but very passionate about it. And she's responsible for doing a lot of this early research in declining sperm counts. And so those are, if the listeners out there really want to take a deep dive into this, those are two really good resources, two good books that they should check out. And your eyes will be opened. You won't be able to unsee what you see in those books.
It's hard though, isn't it? And that's the thing. Having these conversations, I always think is really difficult because while you want to draw awareness to it and an understanding to it, I feel actually we're kind of treating the symptoms by the time they come to your eye in clinic.
Yeah.
Individuals, it's the times. But it's like you say, it's looking forward to see, interesting to see in years to come how or if this gets managed. But it would have to be a global effort to sort of make some changes.
Ultimately, to really eliminate this.
Yeah.
I don't know that we'll ever be able to do that. There's apparently over 16,000 of these endocrine disrupting compounds that are used in the plastics industry. So I just don't see those going away. Or they'll come with another 16,000 that are not on the list, and then we'll start over again.
Yeah.
So it's a little bit disheartening, and you're right. We do end up treating the symptoms, but I still think it's worthwhile to try to eliminate these things. There are studies out there showing that if you pick the right foods and you eliminate certain consumer products, you can drop your levels of these in your body by 30-40%. And maybe that's enough. Maybe that's enough to restore some natural hormone balance and to potentially prevent you from developing cancer prematurely or heart disease. Heart disease is another big one, not to go off tangent, but these endocrine disrupting compounds are like starting to be realized as major players. They've been found within the atherosclerotic plaque in both the heart and in the carotid arteries. There's documented findings now that a lot of these guys that suffer strokes and heart attacks, they have microplastics like embedded in the atherosclerotic plaque. So when they look at it under an electron microscope, which is crazy, So, and they found that if they screened for microplastics, and if you had microplastics within your carotid atherosclerotic plaque, for example, you had a 4 times higher risk of having a stroke because those plaques are chronically inflamed. The body's like constantly reacting to these microplastics. And so it's inflamed plaque, obviously, that's prone to rupture. It's
Wow.
crazy. There have been microplastics found in penile tissue now, and not just in old men, but in young men. So our bodies are just saturated with this stuff.
I mean, I read a stat when I read a study when they were saying that something like 93 to 90 people have got BPA in their urine.
Yes,
And
yes.
alarming.
Yep. Isn't that wild? Yeah,
Yeah.
well, it begs the question, like, what are the 3% doing? Like,
Yeah.
where are they? I want to go live
Right.
there.
Go hang out with them. Yeah, no.
Let's go hang out with them. They're doing something right.
So
Yeah.
what's your advice? I mean, obviously really great. What's the advice that you give to your guys that come over to your clinic? Are you just giving sort of generic advice? What would you
Yeah,
say? Well,
in some way I am, because I don't want to be fatalistic about it, but it is impossible to completely eliminate these things. So, and again, you don't want to, if you go crazy with this stuff and you try to turn people's life upside down and overnight, take away the daily products that they like to use, it's not going to work. They're not going to comply with that. It's just not going to be sustainable for them. So the big ones, I say, eliminate all plastic cookware. So don't store your food in plastics. Certainly don't microwave things in plastics. If Don't drink out of plastic bottles, reusable bottles. Canned food is particularly bad. That sort of waxy feeling in the inside of a can that's loaded with endocrine disrupting compounds. So try not to eat canned food. Non-stick cookware should just be replaced with plain old-fashioned like an skillets. And you can use some olive oil or avocado oil, which is obviously good for you as if you're having issues with sticking to the iron skillet. I know that's what I do. So stuff like that. I'm drinking my BCAA beer out of a aluminum lined can, and so I have eliminated all the plastics. I try to use sunscreen at all. I'll wear here in the UAE. So I wear a hat and I wear long sleeves. And when I do use sunscreens, I use just like a zinc oxide based. So I look funny. I've got the white stuff on my face, but I don't care. It's my life. I don't really care. So
sunscreens,
what's
right?
that? So yeah, sunscreens many of them are particularly toxic, and they very readily enter, cross and get into the bloodstream. So I try to avoid those. So it's kind of basic stuff like that. I think you have to just sort of start slowly, as what I do with my patients. Yeah, start slowly, and then as you like when a guy comes in and he's first diagnosed with low testosterone, it can be kind of overwhelming. All this, learning how to eat properly, learning how to exercise, having to take testosterone on a scheduled basis. Like it can be, and then now you want to throw in all this stuff on endocrine disrupting hormones. I mean, you can their eyes glaze over. So it can be a little bit too much. So you have to like spoon feed information. And you don't sound like conspiratorial, because if you really go down the rabbit hole with this stuff, you can sound like a tinfoil hat lunatic, and then the patients don't want to listen to you. So,
well, I think also, as you say, you can go into overwhelm, and actually worrying about it anyway isn't going to be, the controlled, and then the rest of it you just to a degree. It's interesting what you said about sunscreen though, because that one, I mean, not need to use much of it, certainly in the UK right now.
Right.
But yeah, using the physical sunscreens as opposed to the chemical ones, which again,
the sunscreens.
Yeah, and it's interesting. Again, that's the sort of thing that we put kids from such a young age. We've gone in the UK gone from the 80s when one had sunscreen and people were sort of lying in the back garden with olive oil on, getting themselves all sunburnt to the and I just don't think a lot of people are fully informed about a lot of the chemicals that are in there.
No, they're not, and most physicians are not aware of this either. This is not like widespread whatsoever. The endocrinologist about it. There's some really good things on the endocrine website. If you dig around in there, they've got some really good information on endocrine disrupting compounds, but nobody's listening to them, and GPs of the world, the internists and the surgeons and everybody else, I think is just as clueless of this as the general public as well. I mean, I was dismayed to find out that, the eye that I use every day is loaded with phthalates.
Wow.
So whenever you put an IV in somebody and you're running saline or lactated ringers or whatever the case may be, they bind to the plastic. They're just sort of loosely associated with it. So it gets picked up by whatever you're infusing and it goes right into the patient, right into the patient. So, just on a personal note, my was just born on just last week, and he had a little bit of a rough start. He was in the NICU for a few days with some respiratory issues, but of course they put an IV in his hand and were infusing some antibiotics and giving him some dextrose and things. And in addition to what I was worried about with him, I just saw this tube and I just was thinking, oh my God, he's life. He's being infused with phthalates, and he needed the antibiotics. It was a risk benefit thing, but it just sort of made my stomach turn a little bit as I saw that stuff going into him. So but we don't think about that at all in the medical world. The stuff that we use in the hospital is not EDC free. In fact, it's loaded with it. It's not.
And like you say, it's that point in time where at that point in time you're thinking risk benefit ratio, and
it's all benefit,
still sad for that moment. That must have been.
Oh yeah, it kind of broke my heart a little bit. I just was like, I'm sorry, buddy.
Well, he's at home though. That's good.
Everything's good now. Everything's good now. So we'll see. We'll try to play catch up, I guess. Gotta minimize his exposure. But again, it's tough. It's tough.
And even with that, like kids' toys.
Yeah, that's a other problem.
Yeah, like even things like that, and where everything goes in advance, like carpets.
Yeah, anything has flame retardant material in it. So they're called PFSs, these polyfluoro unpronounceable names, PFS, that are in clothing, they're in bed sheets, and anything that's any sort of like flame retardant to it. Camping tents it's in all stuff, and
you also
think
that when kids are going to be more in contact with this stuff, it's when they're small, it's when they're tiny, they're
got
higher body fat percentage. So again, they're going to retain
it. They put everything in their mouth. Everything goes in the mouth.
Everything.
It makes you wonder, and I think getting back to low testosterone phenomena, I guess it shouldn't be that surprising that we are having these young men come in with such low levels, because again, they're being exposed from day one, and I guess it shouldn't be surprising. It's tough though, because they're not a risk-free venture, and there's infertility but it's tough. I struggle with this all the time. What do you do with the 23-year-old who's suffering, who's profoundly hypogonadal, yet tells you he has a fiance and wants to have children in a few years? I don't always know what to do with those guys.
I think having really open conversations is really super important at that point. And you often have the 23-year-old guy who's like, yeah, but I don't have kids. And it's like, no one wants kids at 23. There's very few people do.
Exactly. Just wait, buddy. Just wait.
Sorry. So I think, it's to have open conversations, and it's also kind of discussing the low testosterone, even if you can tolerate the symptoms and you can get by or whatever, it's making sure that they're kind of the impact it's having on their metabolic health, on their overall health, on their bone, on their mental. And you think a lot of times guys that are testosterone deficient, as I'm sure you'll be aware, have issues with decision making and this brain fog.
For sure. They're not decisive. They're less decisive.
Exactly. So you can chat about HCG and like that, but again, it's expensive. It's not with side effects, and there's some guys that just can't tolerate it. What's your experience with HCG? How do you find guys get on with it?
Highly variable. So I don't, like a lot of clinics, I don't start HCG typically right out of the gate. It's always it's on a case by case basis. And it's my preference not to start HCG initially with TRT, mainly because I just don't want to complicate things. I want to keep, if I had to do an intervention, I like to do it one at a time so we can assess, what's the response that we're getting, if you have side effects, which is the one that's causing the issue, that sort of thing. Obviously, if fertility is in the picture acutely, then you need LH and you need FSH, or you need some sort of a mimic of either one or both of those. And there's no getting around that. So HCG in the mix initially for men who are, if they have a child within a year with their partner, then I will start it, earlier, later, obviously. But in terms of how men feel on it, it's highly variable. Most men, it's been my experience, if I had to say the majority of them feel either neutral or, perhaps an improvement in libido, that sort of thing. But there's a substantial number of men, as you alluded to earlier, that have a seriously negative experience with it. I think of one young man in particular that developed some of the worst cystic acne I've ever seen, all across his back and his chest within just like 4 to 6 weeks of starting HCG, and truly, like, had it under control, it would have been scarring acne. So that's not a typical response, but it is out there. People have mood issues with it. It's not a naturally occurring substance in a man. It's not LH. People think it's LH. It's not LH. And so I can't all predict who's going to do well on it and who's going to be intolerant of it. So it's really, for me, it's a fertility drug.
Yeah, for sure. And I think it's interesting because I find there's kind of like one, didn't really notice much, and it's just anxiety, testicular pain, skin issues, all of that sort of bag. And then the next one was like, oh, it's a missing part for my TRT. I feel fantastic.
Precisely. Libido, etc. Through the roof. But you can't tell, like, I don't know, maybe you can. I can't predict which guy, if he's going to go in which category. I can't predict it.
And I've had guys tell me they've had no issues with anxiety in the past before and into blithering explosum. It's completely some cessation of HCG. So and
interesting.
That becomes a problem if they do want to conceive. That's where it starts getting really.
It's a problem. Yeah, it's a problem. I was on HCG for over 10 years for fertility reasons, and thankfully I was one of those guys. I had a fabulous response to testosterone, but I didn't notice. I had a very neutral experience with HCG, and it wasn't either a positive or a negative. It did work pretty well. It obviously helped with fertility, but I've been off of HCG now for over a year and a half, and I don't notice a difference. I really don't. I'm glad to be off it. It's just one more thing that's complicating my life. So but it is it's in the cards for the young guys, especially. And so it's yet another thing that we have to deal with. So
and it's an extra cost, which particularly for extra cost as well, which actually for the
it's in the United States with some of this new legislation that has prohibited the compounding of HCG, it's gone up tenfold. It's really actually outrageous. I'll go off on a rant about that, but it's really frustrating. Because it's already to start a family as it is. It's already inordinately expensive if you have infertility issues, and now the price of previously dirt cheap medication went through the roof. So really frustrating.
Fun, right?
It's frustrating to me that I actually don't charge for it, so to speak. I just charge if it's for fertility, because side note, my wife and I went through infertility for quite some time. We both had fertility issues. So it took us 10 years to conceive our first son. And so, I'm acutely sad, and I just can't charge $300 or $400 for a bottle of HCG like some of these TRT clinics do. So whatever my cost is, and it varies with the brand name, that's what I charge the patient if it's a fertility thing. So I feel like that's the right thing to do. It's not the right thing to do when you're running a business, but I think I can sleep at night a little better.
Yeah.
So
Well, that counts. That's an important element.
It does count. Yeah, it does count. So.
Yeah, I had quite two patients recently who've been started on TRT, and they'd in a different clinic. They hadn't done fertility tests prior to starting on TRT and had it without HCG, and then got to a fertility clinic, and their levels were low. Both of them had very, very low levels and needed to be on TRT. And the fertility clinic's response was to tell them to come off the TRT in order to regain their fertility. Pre-TRT, neither of them could maintain an erection and had no libido. So I don't quite know what the plan there was, but it's not, I don't know of any UK NHS facility offering
Wow. I guess that story, I guess I used to be surprised when I heard that story, but I've heard that exact same story so many times now that I am just not. Yeah, it's common in the US in the endocrine and urology world to just tell guys to stop testosterone and then not provide anything else and just sort of hope and pray that maybe in 6 months, maybe in 12 months, you'll be able to regain some degree of fertility and then have a spontaneous pregnancy. It's just wrong. It's just not. It's unethical, I think, to do that. But that's kind of the standard of care. It's been my experience that guys can remain on TRT for the most part with a reasonable protocol plus or minus recombinant FSH. That's actually what I stayed on my full dose of TRT. I had HCG in the background and had a reasonably good sperm count, and then I added recombinant FSH in there, which boosted it significantly. And yeah, we had 3 pregnancies when I was on that protocol. So it is, every man is different. Everything's on a case-by-case basis, and nothing is guaranteed. But many times it's been my experience, you can remain on testosterone, still have all the benefits of testosterone, and remain fertile.
Yeah.
So
yeah,
I don't know if
I always warn guys that this is not considered as a contraceptive as well.
No, no. Be careful.
Yeah, exactly.
Yeah.
It's interesting. More and more being more comfortable and being happier talking about testosterone replacement therapy and testosterone deficiency, which is great because I think one of the hardest things sometimes for guys to reach out to clinics like like Man Medicine clinic, that they just don't know that it's a thing. But also, in the UK have loads of touch points in their medical lives, so to speak. So, they'll go to about periods, about contraception, about pre and postnatal.
Not men.
You might get a 40s health check, maybe, if they're lucky.
Yeah, maybe. Right.
Yeah.
Yeah, exactly.
Their health is, something to be, they're not used to that health, they, reaching out for healthcare checks and everything. So I think often when they get turned away with a normal testosterone that isn't normal, they're looking into it can be really delayed until wheels are falling off, which is a shame.
Yeah, it's really unfortunate. It's really unfortunate. And many times when they seek it out, it's gonna be a negative interaction with, often, as you kind of mentioned earlier, a urologist who just doesn't understand how important it is. And I know I don't mean to disparage endocrinologists or urologists. They're brilliant in what they do, but many of them don't truly, I don't think, just how life-changing therapeutic testosterone can be for a man that they use are excessively strict, in my opinion, and they're missing out on the opportunity to radically help a large number of men if they would just be a little bit more open to the benefits outside of their current guidelines. I'm all for guidelines. There's nothing wrong with guidelines, but they're excessively strict.
But I think especially on the background of everything we've been discussing here today, Andrew, like this background of the endocrine disrupting compounds, it's so important now of all times to be, even if you just take it to a level where you're taking it to the same understanding and you elevate to the same height, and you elevate knowledge in the medical world, and not just in primary care physicians, but in endocrinologists and urologists, as you mentioned. about this, about how this is impacting men, and just the basic treatment options for them so that they don't get turned. And actually, their first real recognition of having testosterone deficiency isn't when they've just had their first heart attack and they're already type 2 diabetic,
Right.
you know?
Exactly. Yeah, at that point, like the horse has left the barn, so to speak. So I think that, this is such a pervasive global problem as we alluded to earlier. And it's becoming so pervasive in younger men that, I mean, if I had things my way, this would be part of the core curriculum in every medical school in the US, in the UK, in the world, honestly. Because the fact of the matter is there's going to be probably billions of men on this planet with suboptimal testosterone levels. And there will never be enough endocrinologists. There'll never be enough urologists. This needs to be solidly in the GP's domain, and they need to have a really good understanding of it. And it's not taught at all in any medical school anywhere. The residents and medical students I've worked with over the years in the emergency department poke fun at me because when they're in the emergency room, they're not expecting to get quizzed on testosterone, but I do it. I was like, this is my opportunity. I don't care if you're going to be an ophthalmologist or you think you're going to be, we're going to talk about testosterone not during the shift. And they really appreciate it, I found. They actually find it really interesting because nobody has ever talked to them about it. It's not even mentioned.
Everybody covers, but why not men?
No. It's crucial. It really needs to be just like every family physician, every internist, they need to understand type 2 diabetes. They need to understand heart failure. They need to understand hormones. And because this problem it's a global problem, it's pervasive, and it's only getting worse. And there's not enough Eden around. There's not enough man medicine clinics. There's not enough hormone clinics in general to service all of these men out there that really they desperately need the help. And I can only imagine what things are going to be like in 10, 15, 20 years from now. It'll be much worse. So this needs to be common knowledge. Again, if I had it my way, it would be taught in all medical schools on day one. So probably wishful thinking on my part, but
one day, I think, to be fair, I think it has to, we cover global fertility issues and testosterone deficiency, the war really, but hopefully, like you say, clinics come up that are able to support and education information to these guys. And help them restore their social lives, their family lives, their work lives.
Absolutely.
There's really, really good resolution to be done for these guys. And
absolutely. There's a reason I'm such a big advocate of testosterone therapy is because everything you just mentioned is what it did for me. I mean, it's for me to even consider what sort of a 51-year-old I would be right now if I never had my hypogonadism treated. And I would be a mess. I would be a metabolic mess. And it radically changed my life for the better in ways that I can't even describe. Just mentally, emotionally, I'm a better husband, I'm a better father, I'm a better doctor. I'm just a better human being because I started on testosterone therapy. And I think all men deserve to have that opportunity if they're suffering from low levels, because it really changed my life. And so I got so excited about it. I had to learn as much as I could about it. I wanted to help other men have the same sort of experience. And that's generally how it goes. I mean, some men don't, but they're the outliers usually. And many times it's a poor protocol or it's, something else. They just never really should have been put on testosterone to begin with. But the vast men have a really positive experience with testosterone, and it improves their health in all the ways that I just talked about. So it needs to be on the table. It needs to be openly discussed. And it used to be sort of shameful thing or something maybe in the locker room, only guys would sort of whisper to each other about being on TRT, but it is becoming just more of an everyday conversation, and it needs to be. That's just how it is.
Well, thank you so much for joining me today.
My pleasure.
It's been a really great conversation. It's, I think positives out of it are that guys can get treatment for this now. People are having conversations about this, and restoring the quality of their life as well now. But yeah, it's just spreading the word. But again, thank you so much for joining me today. And if anyone,
thanks for having me.
no, thank you. And I'll send this to you. And if anyone's got any questions, just
Very
drop
good.
them down below. Thank you.
All right. Thanks.